Naama Cohen-Hanegbi comes to us from Tel Aviv University, where she's a professor in the Department of History, studying late medieval society and culture through the prism of the body, health, knowledge, faith, and religious belonging. Her first book was called Caring for the Living Soul, Emotions, Medicine, and Penance in the Late Medieval Mediterranean. It explored medical understanding of the soul and emotions and links between medicine and ideas about sin and penance. Her work more recently has focused on Christian healthcare in late medieval Spain, as well as postpartum mental distress in that same era, looking at things like mental instability, demonology, and childbirth. She also coordinates and mentors other scholars and scholarship and does a lot of service to the field. So she leads an ERC research project called Medieval Placebo Effect, Hope and Belief in Healthcare in Christian Southern Europe, serves as the director of the Morris E. Curiel Institute for European Studies at Tel Aviv University, and co-edits the Mediterranean Historical Review. So we are very, very lucky to be hearing from her today, that she's taken time out of all that to share some of her work with us as part of this series.
Well, thank you very much, Anna. Thank you, Diana and Brian and the CAT Center for inviting me. Very happy to be here. Let me just put my own screen so I can see. Okay, so I would like to begin with a little story that appears in a medical manuscript from 15th century Castile. There was once a pregnant woman who was inflicted by a sudden sadness, and I feared that the child was dead in her stomach. And I ordered to give her to drink white wine, coral, pomegranate, and cinnamon, and pearls, and the incident was lifted from her. And women already accustomed to give grilled fruits with cinnamon. This little emotional vignette into the life of an unknown woman is brief and in many ways unrewarding. We don't know who this woman was, how did she come about to reach the physician who wrote this story, and we don't know how he came by a suspicion or a diagnosis. It is not clear whether he thought that the patient's sadness was induced by the death of the child, or whether it was caused, or was it the cause of it. According to medieval medical thought, both were possible. And it also remains ambiguous whether his remedy treated her sadness or was in fact an abortifacient. But there's also what we can gather. The first that I will not go into today, but will hover through some of the examples I chose to bring, is that sorrow was associated with bodily states. And the others are that women were treated by male physicians for illnesses and malaise, and that were associated with pregnancy and with others as well, and that they knew well that women amongst themselves used similar practices, though they might have been less elaborate and cheaper, and that they would also treat one another. The structure of this vignette provides further information. As you can see in the slide, the very short account, which is here in the black, it's very short, appears within a long collation of recipes and remedies, an anecdote, just another way of offering medical knowledge. Alongside remedies that were learned from other texts, from other doctors, usually without commenting further. There is an implicit statement about the equal efficacy of such knowledge. This may seem straightforward when it sits so neatly on the page of the manuscript, but it deserves attention. What did male physicians know about women's medicine? To what degree did they practice such medicine, or treat women at all, was a question that historians of medieval medicine have been debating for some time. Shaped by Boccaccio's apocalyptic description of plagued Florence, in which, out of dire necessity, even the most modest women might turn to male doctors for care, popular understanding of medieval medicine maybe still is, under the impression that there was a segregated notion that men would women would be treated by women, especially in aspects relating to the genitalia and to reproduction. And that also men would receive their knowledge from medical text, theoretical text, often thought of or were misogynic, that would have little input from women themselves. The past 30 years of research of the topic of women in medieval medicine has shifted our understanding. It has become very clear that there was a tradition of text on women's bodies that was misogynist and that was circulated among men for men, and that was also a basis for commentaries and elaborations. There were also imprints of practice. And there were some, and there was also, it was also indebted to women. In the world of Hebrew texts, we can think of the Trotula and its renditions into Hebrew that was studied by Monica Green, and Rambal Ka'i, and Carmen Caballero Navas, and of other texts, other major contributions to our understanding that should be stated here are the information that we received through a text of a Mohel, of a circumciser, that received knowledge from women, which Elisheva Baumgarten published, and the work of Carmen Caballero Navas, who has shown the many incidents in which physicians, in their writings, in their texts, Hebrew texts, include knowledge that was gained from wise women, from various women, from women with names that seem very characteristic of a known midwife like Puah, and women that were assumed to give this kind of knowledge. But despite these tradition of learning, there is still our information is very patchy about how medieval medicine for women and by women was practiced, and it is especially practiced when considering Jewish or Hebrew medicine. In my talk today, I would like to turn our attention to notebooks of physicians, like the ones we have in front of us, to consider what they reveal to us about male doctors, how male doctors saw women and their bodies, and also how they gathered this knowledge. But to think about this knowledge in a way that is complex and varied and layered. And what does that mean, that this knowledge is varied and complex and learning and layered about the understanding of women's body? So my main theme will be male physicians and knowledge of women, and I would like to look at it through various elements. So the first would be women as bodies or objects of medical knowledge, women as patients, women as informants, women as teachers of medical knowledge, and women as members of a household. What I would like to show you through browsing these texts and bringing to you various excerpts from these kind of texts, how all these forms of learning about women's bodies play in these texts together on the same page, intersecting together and shaping in a very complex way what men would know about women's bodies and what women also knew about themselves. Because another question that is hovering here is what women did when male physicians weren't around, or when they were around and they didn't understand. So what is beyond what we are told by male physicians, and how much can we know of these practices that women did for one another? did they recourse to learning in any kind of way, and were they formally trained? So some of these, this part of the information will hover around. I will try to signal it as much as I can as I speak. I will do so by looking at a few medical books, two in particular, and recipe collections that were written between 14th and 15th century. The main two are from Spain. I will say a few words about them and about how they were collated, though we know very, very little about them. The first is Chaim ben Musa, who is a very well-known polemicist who wrote a treatise called Magen v'Cherev, Shield and Spear. In Spain, debate between him and a known Christian author in the 15th century, mid-15th century. But he was a physician in his main job and his main work. He was born in 1380 in Bihar near Salamanca. And we know from very, very little about his life, which tells us that he was a court physician in various courts for 40 years or more. Kings and countesses, we'll see some of them later on, were his main source of income, and there he spent his life among the Christians. And that is what we know. We know very, very little about his own life. But I will try to suggest and try to show you that by reading this book that was really cast aside and wasn't looked at, we can somehow arrive a little bit more to how he shaped his understanding in his world. So this is one of the texts. Maybe I will say another thing. What we do know about him is that he wrote a letter to his son sometimes in the 1450s, where it was very difficult already in Spain, and the feeling of the imminent expulsion was already there. And it's an interesting debate about Jewishness, about the possibility of the Messiah coming, and about the dire state of they were experiencing in Spain at the time. It's a work that should be done juxtaposing this medical work with his more theological work. Another book that I will look at is again from Spain, perhaps a Catalan origin. We don't really know much about it. The only information we have is in the text itself. It is written like Chaim ben Musa's collection, with many instances of a first voice, but the person who is speaking, we do not know who he was. Again, these two texts are collations of translated medical texts from various languages, from Greek, from Latin, from Arabic, and Hebrew original text, and many, many recipes from various origins. Some of them are from learned medical texts that we know of. Some of them are very Galenic in their nature. Others, you will see, they're more popular of sort. And all of them are put together in a way, I don't know if you can see from these two pictures, in a way that doesn't show any hierarchy between the different kind of sources. I will also look at a few more just to show the wealth of information we have. Within all these texts are little excerpts, little anecdote, case histories, stories about actual healing, actual medicine that took place at one time or another. Sometimes the patient is mentioned by name, mostly they aren't, but it is a clear point that the physicians make to write that this was not just a general recipe, but a directed personal recipe. And I will go back to this aspect later on. The first and most obvious way of earning knowledge about women's bodies for a physician who studies medicine in some way or another would be through text. This is the I said this was an obvious. I think it's an obvious way for a physician, a learned physician. Obviously, there are other ways of learning, but these physicians who their method of learning is through the medical text of the Galenic tradition. That would be a central source to look at, and indeed, in these collections, they include texts from the main authorities of learning, from Galen, from Hippocrates, from Ibn Sina, about the various aspects, including complete chapters on women's bodies. But these texts include another way of learning, which is collecting of information from various ways that directly talks about women. Sometimes these cases, this information about women is a bit surprising because mostly it deals with pregnancies and genitalia and reproduction. At other times, there are surprising incidents where the issue of the fact that the patient is a woman comes into the text in a strange way, like here. This is a recipe for women's illness, a throat illness for women. But it's important for the physician to note the fact that this relates to a woman that actually lived and actually was treated, and this certifies the knowledge. It allows this knowledge to come into this text as with a credential of a certain medicine. Again, more often I didn't translate this, but this is a very regular kind of recipe of how to birth women. And again, another way that we find these women in this text are recipes that are general, that are not for a specific woman, but there are instructions for what to do with the woman in certain kind of states, and this is obvious. It's for a woman. It's for miscarriage. What is interesting about this recipe is that it comes from a completely different tradition to what we have in most recipe of written texts that include Galenic medicine. As you can see in the text, it's the instruction is to take a chicken in the egg and burn it and give the ashes in the water that the woman will never miscarry. So it's a preventive medicine that involves what we call apothecary, that is using various materia medica that is not herbal and includes animals, and also burning and different kind of ways of preparing the medicine that is indicates that this originates from a more popular kind of medicine and a less learned. So we have in this text mixed together these kind of remedies that come from popular knowledge and text and the knowledge that comes from the text. Another form of learning that appears in these notebooks repeatedly is the notion of hearing, of gaining knowledge through oral means. I heard from a doctor, and here I will just tell the story that links to my other interest, and I'll be happy to talk about it in the Q&A afterwards. It tells of a woman who was mentally ill, and the treatment that he used is cutting a snake into 9 pieces, boiling it, and then giving the woman to drink the snake and to eat the snake, and then putting the fat on her ear. This is a medicine that is nowhere mentioned in any kind of Galenic text. It's, again, a Dreck-Apotheke kind of medicine, but it is included here as part of the way that medicine works, and it is spoken from a doctor. What does that mean to be a doctor? And here's another issue that I kind of glossed over by translating the word into doctor, because in Hebrew this works. We don't know exactly whether they were learned physicians, they were popular physicians. What does that mean to say that he heard it from a doctor, from a Rofeh? I might return to this later on. As I said, another aspect that comes in these texts is that they are interested in individualizing medicine. And this is a text in Spanish. I will not go into it here now for the lack of time, but what is clear is that these physicians treat specific women, and they tell the stories of these specific women in their text with various aspects of information that would link, would associate or indicate about these patients. Like here, this is a 14-year-old girl. Why is he mentioning the years here? We're not mentioning the name of the person, or not indicating. This is part of credibility, perhaps, part of indicating that this is something that can happen. And the way this is told by personalizing the medicine is offering observations about various incidents that can happen. And this is another way of transforming the knowledge of the practice of medicine into knowledge by saying, this is what I've done in this incident, particularizing it. And in one of the cases, he even says, this is how I learned from writing these cases. I will read one story, and that is another personalized affair. I saw a woman after she gave birth. She had confusion of the mind and boredom, and she did not want to eat and to drink unless she was forced. And when she was cold, she would not hear and would not understand. And she was like that for half a year. And after that, she had a heavy skin disease all over her body. And after that, she was purged from the skin disease, and she was healed and returned to her former health. By localizing this story with a specific woman, with a specific case, we see another element of what personalized medicine allows. There is a narrative that comes into the story. There are symptoms, and there is a story of how the disease progresses, which allows, we can imagine, thinking about how the physician will use such knowledge by reading these various symptoms and information and adjusting their worldview or their understanding of illness through these little stories. But at the same time, when this is told in this way, when this is introduced in this way, there is an interest in the specific manifestation of illness in each woman. And this is repeated in various texts, and here I just showed a few, brought in a few cases where, again, there's a localized medicine for a specific person, a specific woman, and what exactly is given to her. Again, the proficiency of developing understanding of an illness in women, and sometimes it is not related to the fact that she's a female in a very specific way. These are two cases of kadachat, of fevers. But here is a case of a woman that her womb dropped. So there's an understanding of women's bodies through this specific story and a manifestation of these ideas that they might have understood and learned in other texts in a broad way as they are manifested in specific stories. Another aspect that comes into these little stories is how the physician positions themselves. In these stories, they describe how they deal with the patients. And we can see slowly, or in the various stories, how intimate is the physician with these women. Sometimes they give her themselves. This is a story, incident of a woman who is over abundantly menstruating, and the physician is describing the relationship in a very personal contact with her. He's giving her this in the beginning, and later he's giving her another thing. And he's bathing her. So he's preparing the medicine for her and giving it himself. This is not always the case. At other times, he's ordering other people to conduct the medicine. He offers the recipes, but he's not there himself in the techniques of the medical technicalities. This built into another element of what we understand that was going on in women's medicine, that there is a relationship between physicians who are in charge of addressing the illness and describing or prescribing the medicines, and the women usually who are doing the actual taking care. So I will put this aside. I will show you another element of this in a moment, but I want to show you one other thing that happened in this text. By looking into this case where a woman has a iron in her foot, and he's trying to figure out how to heal her. There's a whole story here of she becomes fevered and then she becomes frenzied. He's figuring out how to give this woman the precise medicine. But in this manuscript, there is another, in another portion, there are various notes of giving recipes for the same kind of problem of iron or wood stuck in the foot. And in juxtaposing these texts together, there's we can learn of how the physician is trying to make sense of the relationship between practice and theory, between ideas about giving medicine and or recipes that he knows, and how to put them into practice. In some of these notebooks, there is an actual going back to how what Maimonides said about a situation and how this implicates to the healing that should occur. Another way of learning about what women's bodies appears in these texts as women are informants. They tell the physicians of different medicine that they took. Some of these women seem to be his patients. I treated a woman and she told me about what she did. And sometimes there are just various women without any kind of definition to their stature. but he's entering this information into the notebook, and this occurs both in all these texts, in all these notebooks. They hear from the woman what she did, and they put it into their notebooks as a way of another recipe. Maybe one day someone would use, he would use. And other times we find the more classical women as teachers. I heard from a wise woman about the way women do medicine for women. I will not go into this too much. If you're interested, I'll be happy to answer more about this relationship and how it comes about. This another element of women, and this I referred to earlier, that women are seen in the hierarchy to be in a lower stature than the physician. Here's another interesting example of this. There is a mediated, a midwife, here by her professional name, with a professional signature. She has knowledge of doing what she does, and she has a specific role in the birthing room. But here the doctor is ordering her or suggesting to order her with a medicine she wouldn't know, with an idea for a medicine she wouldn't know. This is a very interesting piece about immunization of children from an illness. He's instructing the midwife to do various things that she wouldn't know, and it is very clear here that he understands her position as a midwife, but she's not of the her knowledge is relegated only to taking care of the parturient and not of other elements of medicine that he knows more fully. A final element in who the doctor is learning from appears mainly in Chaim ben Musa's text. He learns from his patrons. Here is he repeats various medicines from the woman he works for, his lady. As I said, he was at the court of various different counts and princes in Spain, and he introduces various medicines that he learned from his countess that he treated, and that he gave her medicines, but also that she told him various things, and this kind of relationship that he forms with his patron, but his patient, it teaches us of a different kind of relationship. Again, an oral relationship, and an oral relationship that builds on the fact that there is knowledge coming in various ways, not only the regular hierarchy that we would expect from a physician to a patient, but also patients and women of the household. Introduce the doctor into various instances that he needs to care for women. He needs to appreciate the fact that women have different kind of knowledge that is worthwhile to obtain. Finally, two very quick examples to show that how this lives within this text. These are men who had households themselves. They treated their daughter. They treated. There's a case of a doctor treating a slave of a friend. There is information of. There is a very interesting case from 16th century Italy, of a doctor who treated his sick wife with melancholy and the various processes he goes through in treating his wife. So he's a physician, but in a way, the writing of a cure and the medicine for his wife allows him to speak in a very different way about what this medicine does. Again, this personalization is already involved in a way of a cognitive involvement, not to say an emotional involvement, of what this relationship of being a physician to a woman might entail. But a last point I would like to return to is the fact that this knowledge is composite. Because if what I've shown so far in running through these various examples of physicians taking care of women, giving them medicine, listening to them, hearing about their previous experiences, about different medicines they tried, offering and finding and looking through different options of treatment, these men are still authors and writers and readers of texts that tell a different story. And in this notebook of Chaim ben Musa, after him repeating all these stories that he heard from women, either patients or his patrons or other healers, with very little rejection of their words, we find this little text that he copied from somewhere else, and with a very classic, traditional idea of women and their secrets of women, which is a theme that we find running in medieval medicine in various places, that is on the border of Macedonia, as you can see in this translation that I have in the third part that I translated. It is very obvious that these physicians hold together different traditions or different modes of knowing about women. I think with this, I will conclude. Thank you for listening.
Thank you so much, Naama. This is such, I'll give you a moment. This is such rich material. I thank those who have put questions and encourage anyone who has additional questions to share them with us. I want to start, Naama, by asking if you can tell us a little bit more about Chaim ben Musa himself, when he lived, where he lived, what we know about him, and this, secondarily, this really intriguing relationship with the Countess. What do we know and maybe not know about him?
We don't know almost anything. So we know that he served these courts. There's no information which courts. There's no, I think I told you everything that is known about him except that why he left. And there's real work to be done by reading slowly this medical text, which is much more autobiographic than anything else that he wrote. But it's very hidden within these incidents. So there is, I think, I tried, I don't know if successfully, to paint a little bit of the biography of this man by thinking about who he talked to through these women. There's so much more that could be done and should be done by reading closely what he read, what he decides to quote, and the different people he mentions. It does seem. So I ran into him because I was working on Meir Godesh. So he was very much part of the social milieu of 15th century Jewish rabbinical physicians. And he And in that respect, we can imagine his biography, but to say in a more exact way what we understand about who he served, it's very, very difficult at the moment.
There are a number of questions that are arising about midwives and their practices. And it may be partly because last week in this same series, we heard from Jordan Katz about early modern, like sort of late early modern midwives. And so in a general way, I think we could just ask if you can tell us a little bit about, again, whatever is known. It's so much harder to find sources for the period that you work on, but what is known about the work of midwives or female women who assisted in birth. There's a specific question about whether they kept records, and if not, is that because they were illiterate? But I know there's so much more.
So it's a good way to start with a specific question. No, they didn't keep any records. We don't have any. We don't know if they were illiterate. Obviously, some women weren't. They could know how to write a little bit, maybe, and they could maybe read. But it's not that we know in a very precise way. We can just assume by understanding, by knowing the society and the different groups of women who could read and couldn't. And that is why all the practices we know of are we have to extract from what men are writing about. And I did show a little bit of excerpt that he does try to link what he knows of what women should do to what women actually do that he hears from the women themselves. I don't know. I mean, for the more general question, what do they do? That's a maybe it's too general to answer at the moment.
Okay, but you're saying that he did perceive a disconnect between the theory or what's received through the sort of male-centered medical tradition and what he sees women doing.
Yeah. Thank you for this question. I think that allows me to kind of pinpoint what I was trying to make in a better way. There is some kinds of disconnects that we can perceive because if we know Galenic medicine, what he brings it to what these notebooks bring to us is very surprising, with practices that are completely different and irrelevant. But by putting them together in these notebooks, they become one. They become the same tradition without saying this is irrelevant or commenting about the strangeness of these remedies. What we have, it becomes one surface. And then if we imagine a person reading these sources for gaining information, or even himself, by putting them together on the same page together, for whatever reason he did this, whether for him to understand or for future generations, they become the same kind of authoritative texts. And that is very, very interesting in terms of how he's regarding these women. He's practically giving them the same authority as Ibn Sina and Hippocrates.
That's a provocative statement. Do you, let me ask, I'm trying to decide what to ask next. There's a question about the religious dynamic at play. So clearly he's a Jewish physician. Do you, also working with a countess who's presumably not, do you have a sense of, does he refer to the Jewishness or non-Jewishness of patients? Does it make a difference in his encounter with or treatment of patients? How does religion play in?
Yeah. So there are differences between the various texts. The anonymous one writes Be'ezrat Hashem all the time, but they both treat non-Jews. One might be Muslim, some others are definitely Christian. They receive medicine from Ishmaelim and from Arelim and from Goyim. There's these words coming in, and sometimes they're just names or Condessa is a nice way of approaching her, not saying her religion. And this is what we know of the region's medicine, is that it was very, very mixed. And in practice, very, I wanted to say egalitarian, but that's not true. But it allowed for communication, and it allowed for transmission of knowledge, and it allowed for bonding even. This is what appears with this relationship with the countess, but with other patients as well, that there is respect, and there is mutual respect. Let's see.
Both with women and with non-Jews.
Yeah.
Switching gears a little bit, I think there's a lot of interest in the references to either mental illness or mental distress and emotional states. So the first question being, in general, whether these kinds of symptoms and experiences that people have were understood as being primarily physical and the purview of a physician. Are they a sort of, properly speaking, part of medicine for a medieval Rofe?
Yeah. So, of course, I selected these excerpts and I took those that interest me. And there are others that are less mental in orientation, but I am very interested in that aspect. And by having them turn to the physician, they're definitely associated with medicine, and they're usually associated with the body. I haven't found any kind of external impact. So no demons, but that is very common also in Latin medicine. What is interesting is that in some of the cures, he goes beyond the standards of Galenic medicine, or he refers to other medicine that are a little bit on the wild side, I would say. In the case that he is describing of treating a 14-year-old girl, he does the most standard medicine for melancholy. So that works as a very physical. In others, it seems like there is an allowance to do other things, but this happens also in other illnesses. There's a sorry, I forgot the word I wanted to say. There's an allowance of using obviously non-kosher food stuff, and also very many kind of on the verge of magical kind of medicines that they're allowed to be used, and this happens with every kind of ailment that is told in these notebooks. So it does give us a different picture of what we would expect a rabbi to do.
That was the next question, was about the relationship between either these particular physicians or practitioners of medicine and rabbis or kind of rabbinic learning in general. Are they often the same person? Does a doctor have rabbinic training? Does a rabbi moonlight as a doctor, or are they really separate?
Yeah, for sure, they're the same people. And this, Chaim and Musa, definitely, but others as well. In Spain, it's a very clear connection. So most of them were also rabbis, they consult with Maimonides, and they give him the honor and the credit when they consult him. But it doesn't mean that they don't allow themselves to use non-kosher food stuff and things that would verge and.
It's somehow compartmentalized as interesting.
In medicine, there's a healing is important. You can do a lot for healing.
We're almost out of time. I want to share one last question that was submitted by, I think, our mutual friend and colleague, Carmen Caballero Navas, who's watching and listening to it right now, about she was thinking about the case of the 14-year-old girl with the mental disorder and connected with another case where a young woman had the green disease or virgin disease, and then a third case where having just given birth was a cause of a mental disorder. And so she's asking whether there is a sense that different kinds of emotional or mental disorder can be connected with different life stages, if that's a connection that's explicitly or maybe made in subtext.
Yeah, the planted question. I'm writing a book on postpartum mental distress in the Middle Ages, so there's definitely, I find few various sources that are associating mental illness with childbirth and pregnancy in this stage of life. The 14-year-old case is, I think, unrelated. There's no mention of elements of maturation or menstruation or anything connected to this. Yeah. So there is, but it's not always the case that this is associated.
It's a reality we know from medicine today that people don't always fit into patterns, right?
I think this just to say, part of this observation pull of in these stories is that people don't fit into categories very easily, and there is a need to look at them individually and see what they're telling.
I think that's a nice way to end, to remember that the authors of these texts were in a real world dealing with real people and encountering the same kinds of complex problems that we do. So I want to thank you for being with us, for sharing with us this incredible research, delving into worlds that most of us cannot enter.